The Consumption and Treatment Services, or CTS, many people will call this a supervised consumption site, have proven across the country to have saved lives as part of harm reduction. And Talia Storm is the director of the Street Works program in Niagara. Hi, Talia.
Hi.
Can we just start with what does harm reduction
Mhm.
mean? Because I think a lot of people don't understand exactly what that is.
Yeah, I mean, that's a fair question. And I think people often associate it with the type of work that we do in terms of substance use and harm reduction. But we all practice harm reduction every day, whether that's brushing our teeth, putting on a seatbelt, wearing sunscreen. We just lived through a global pandemic where we had masks and hand sanitizer and social distancing. So harm reduction is really about taking any activity and making it as safe as possible. From our context, of course, that is from a substance use lens. So we are trying to reduce the risk of overdose, the risk of infection, so things like HIV and Hep C, preventing those transmissions, reducing abscesses. So it can look very different in many ways. But in a nutshell, taking an activity and making it as safe as possible.
Now, I hear people talk about it and they say because you do dispense clean needles, which helps with Hep C and HIV and those things. And I hear people say, oh, they give out handfuls of needles to a single person, and that just means they use more drugs. Is that the experience? Because you do. I mean, you're not just sitting at the Positive Living office on Queenston Street and handing out clean needles. We'll talk a minute about welcoming streets, but is that a valid way to look at something? We give them 20 needles and a person 20 needles, and that means they're going to use more drugs.
Yeah, that is not proven to be the case at all. We need to think about everyone's lived reality. So sometimes people are coming in and they're collecting supplies for themselves and some other people. We see people who use once a week. We see people who use many times a day. It really is dependent on the person. Best practice, and the evidence shows that it is best to give people what they are asking for and what they need. That is always paired with conversation about substance use, about safer substance use. If the person is expressing motivation for treatment, exploring those options, connections to other services, conversations about safe biohazard disposal. But the reality is, some people are trekking across town to come and access supplies. Other folks aren't able to access as frequently, so they might be taking more to last them for a couple weeks. It really is dependent on the person, but it is always paired with conversation about what life looks like for that person, and also taking the lead on what their goals are. For some folks, they're not ready to explore treatment options yet, and that's okay. I think we can all relate to delaying on calling the doctor or the dentist because we're a little bit nervous about what might come up, or we just don't want to, or we're scared. That doesn't only happen in those settings, but it also happens for folks who are using substances. And if someone isn't ready, that's okay. And we want to keep them as safe and healthy as possible until the time that they choose to address their substance use, if that ever comes.
Yeah, and the office is located on Queenston Street, but you do serve the Niagara region.
That's right.
Uh, so I want to talk about overdoses and overdose deaths, and you and I haven't discussed this for probably more than a year.
Yeah.
During COVID, as you said, there were one of the big problems with COVID and harm reduction was that people were encouraged to not be around someone else, and yet if somebody is using a substance, it's better to have someone who with them who is not using at that time in case there is a problem with an overdose issue or some kind of a reaction. There is another person there who maybe could administer naloxone, which reverses the effect of an opioid. Call 911. And so at that time, if I'm thinking of this correctly, at that time, overdose trips to the emergency room and overdose deaths were very high.
Yeah.
And I looked today and I was so pleased to see that the numbers are well under 100, and they were well over 100. I think in 2024 during COVID, it was something like 11 deaths per month, and now you're down to, I believe, 5.
Right now, the average in Niagara is still 11 deaths per month. It was as high as 16 at
Oh,
one
okay.
point. And I think it's important to remember that deaths are one component there's a lot of conversation about the reduction, and it could be because services are more available, people are accessing treatment. Um, the reality is we have also lost a lot of people. And so, there is speculation that is the pool of people using substances smaller, and therefore we're seeing those numbers drop. It's a very complicated issue when we're looking at data, because it can certainly tell a story, but often it's not the full story, and it's tough to speak to those changes. I look at preliminary coroner data for the tail end of 2025, and we saw a big spike again in Niagara. Drug trends are constantly changing. So when I started in this field, we were just starting to talk about the one that starts with F and how do you spell it, and it was fentanyl coming on the scene. And today, of course, we still see fentanyl, but we're seeing a lot of other substances too, like medetomidine, for example, causing adverse reactions in folks, and naloxone doesn't work for that. So we are always, unfortunately, at the mercy of the unregulated street supply, which will always be changing, in terms of how strong it is, in terms of how people use their substances, in terms of the impact in the community, and in terms of broader health impact as well. A lot of harm reduction is in the realm of prevention, which we previously discussed, and we need to think about that in terms of the toll on our EMS services, on hospital services, and what that looks like. If we can keep people as healthy as possible, there's a ripple positive impact on the other side for our systems and our community as well.
Yeah, and the drugs and the drug supply. Ketamine was the first sort of horse tranquilizer that was showing up, but when you methamphetamine, I have a hard time saying that, but
They're all
xylene,
tongue twisters.
yeah, yeah,
Xylazine,
but
medetomidine.
but xylene is another one that showed up recently. I think if people remember back a year or so, there were 11 or 12 people who died in Belleville at almost the same time because of xylene in their supply,
Yeah.
which takes us to the consumption site,
Yes.
consumption and treatment site, or supervised injection site, as some people know it as. One of the things that you do there is you drug test.
Yes.
So you can test for those substances before somebody who comes to the site uses that substance.
Yes.
And what's the reduction in, or I guess, how many of those do you catch where there is someone who comes in and they have xylazine or anididine or anything else in the benzodiazepines, whatever it is?
Yeah. 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 So we do have drug checking through Scatter, is the name of the device. And people are able to see a more comprehensive idea of what they're using. And what we have learned through access to this program, which has been running for about 2 years now, give or take, is that 22% of people, once they get the results back, they actually either reduce their substance use or dispose of their substance altogether. The reason why that is such powerful information is because it really shows that when people have access to information about what's going in their body, it empowers them to make different decisions, and assess the risk in different ways. Of course, 22%, we have seen that change. The other percent, it would be people coming in and it was exactly what they expected, right, in terms of the drug test. But it does give us a really good sense of drug trends, at least in the neighborhood, and gives more power. Information is power, and that's an important thing. I do also want to correct, because I do see the update on the site about deaths, and you are right that it is now approximately 5 per month in Niagara between January and March of this year. So that is a decrease from the 11. So I'm happy to see that.
Yeah, absolutely.
Yeah.
Absolutely. When someone comes to the site, so let's say I'm a new person and I'm coming to the site. What's the process? And then going forward, are there a certain number of people who, are, I don't know, this is a stupid word, registered?
Yeah.
And how many would that be? And then how many people do you think would come into the site if they were able?
Sure. Good questions. So anyone who accesses the site for the first time, they do a bit of an intake with us and we go over expectations of the space, what we can offer them, what our expectations are of their time in the space. And then they can come in and meet with peer support workers, harm reduction workers. We're lucky to have a partnership with Niagara EMS. They're the team responding to overdoses in the site. And people can come in, get their drugs checked if they're interested in doing so, and then proceed to a booth to use. They're given about 30 minutes of time to use, and again under the eye of paramedics who are able to respond in the event of an adverse reaction. There are also so many partners on site, and we're incredibly grateful for that. And I think that's one misconception of the site, that it's simply for using substances. But we have access to healthcare workers, housing workers, again that peer support piece, cultural components for the Indigenous community. We run groups, so it's really about a sense of community and offering as much as we can in the space. So we know it's a space people are comfortable and they're more likely to engage in service in spaces where they feel safe and comfortable and judgment free. So we're really grateful for that. Last year, we had just shy of 340 unique people access the space. And of course, there's an ebb and flow to that. We see people move between municipalities. Right now, the site is only available in St. Catherine, so not accessible for our friends in Niagara Falls or Welland or other communities. And there is a significant barrier in that people cannot smoke their substances on site due to provincial legislation. So, of course, proper ventilation would be required for that, but we do see a shift towards inhalation use, which is theoretically a harm reduction win, tends to be much safer for both the person using and the broader community. But yeah, there's always an ebb and flow. You know, between 2019 and 2025, we had about just shy of 89,000 visits to the site. And reversed over 1,500 overdoses in the space. So we think, you know, about the dignity that's offered in the space that's so very important, giving that second chance, and then again that connection to services.
Yeah, I think that it's, even when I went and looked at it, and I know a certain amount of what, and I live downtown, and I've talked to you before, and I know a certain amount of what happens. I didn't know EMS was on the site, for example,
Yeah. Yep.
and I didn't know about the groups, and I didn't know about the sense of community, and that's a lot about what positive living is
Yes.
about, is building a sense of community. And let's just talk briefly about Welcoming Streets,
Sure.
which is an initiative with you and Reach Niagara, which is a mobile health support organization. I went out with one of the teams one day and I loved it. I loved there was one situation where when we first started, we stopped at a gentleman and the reach worker said, "Hey, have you seen Bill? We haven't seen him in 4 days. Have you seen him? We want to make sure he's okay." And the fellow thought about it and he thought about it and he said, "You know what? I haven't seen him, but somebody I know, I don't remember the name, saw him yesterday." And the outreach worker said, "That's fantastic. We were worried."
Yeah.
Right. And then, they help businesses understand. And I think that I thought it was an amazing trip that I took out. Is it something that you see as also helping? Now, this would be at the street level.
Yep. Yeah, Welcoming Streets has been very powerful in our community. It's a pilot project, and we're seeing the results of the kind of initial evaluation come through, and it's very strong in terms of what it's meant for people with lived experience who are helping facilitate the program, in terms of the people who are being supported by the program, whether it's street involved community members or the businesses. Welcoming Streets really is about fostering that sense of community that you touched on earlier, right? Building compassion, building mutual understanding, bringing back kind of the street code of ethics, if you will, setting those expectations around cleanliness or where we're using or how we're behaving, and lending a hand to businesses so that they can help be part of a solution as well. And again, the preliminary evaluation results have been incredible with that program.
Well, I know it's a pilot program, so let's fingers crossed. Let's keep
Yes.
it going. The consumption sites came under, okay, I'm just going to say under attack Because I think people have figured out by now that I'm a big supporter of consumption sites. In January of last year, so about a year ago, when the provincial government came out and put some pretty strict rules around the sites. Now, I don't have a problem with rules around the site. I understand that. But one of the things that is that they mandated was that consumption sites couldn't be, so they announced the closure of consumption sites, and also that consumption sites could not be within 200 meters of, I don't know if just a school, but I
School
believe
or
it's where,
child care center.
yeah, yeah. Um, and that resulted in some of the closures. The St. Catherine site was able to stay open because you were not near that, you weren't that close to a school.
600 meters. I looked it up immediately.
And it's not like you're, in a storefront and everybody who walks down Queenston Street is going to say, "Oh, look, there's the consumption site." I mean, and I think good for the people who go. It's sort of quietly nestled behind the backside of a building where I think people would feel more safe going in and out. So I actually want to just backtrack because there was one question I meant to ask. When the clientele of the site, these are not just people who are homeless, unhoused, living on the street and using drugs.
Yeah, it's we do see a mixed bag of folks accessing the site in terms of that socioeconomic background. With the site itself, we do tend to see a larger percentage who are not stably housed, right? And that's where you would see people without access to a site using in parks, using in playgrounds, using on the street, right? It is more visible when people don't have a place to go. In terms of street work services in general, we run a lot of various programs, but I will say we see the entire socioeconomic spectrum in those services. So we go into fancy neighborhoods in Fonthill and Old Glenridge and support folks who are using substances. We often talk a lot about the hierarchy of substances, that some are more glorified in our communities than other. A good reminder that alcohol is a substance, alcohol is a drug that we treat very differently, as is cannabis now. But we do see people from all walks of life who are using substances, and some where it's not in their definition problematic in their lives. They're able to maintain relationships and work, and for others they may be experiencing homelessness or mental health or other components. So we do see the full gamut of folks accessing service, which is a good reminder, because I think people tend to default to the more visible substance use and that it only affects people in that situation, which is absolutely not the case.
Of course, people who are, there are people who are experiencing problems with substances who really want to hide,
Yes.
right? They really don't want, and in a higher socioeconomic
Yes.
situation, that would be normal. They really want to hide.
Yes.
So you can help that, not them keep their secret, but get the treatment that they need, and maybe the ability to discuss openly what they're going through with family or friends.
Yes, stigma is alive and well when it comes to substance use. And you touched on COVID earlier, and that was a stressful time for a lot of folks. And there was the social distancing requirements. And unfortunately, we did see a lot of relapse and death for folks who were maintaining sobriety, because the pressures of that time that we were living through were a lot to handle. We hear time and time again from our community base how grateful they are that they can speak openly about their use without being judged. And that is often the first step to broader conversations and access to other supports, right? And our team, including at CTS, will do what we call warm transfers. So they can walk someone down to withdrawal management and get them into detox services. We can walk folks down to other services if that's what they're keen on accessing. But they have that trust built up with our team. There are studies that show that people who access harm reduction programs like ours are actually 5 times more likely to access treatment at the end of the day, because we can help them get there when they're ready. And so I think that's a really important piece of the conversation.
Yeah, I know methadone is only one part of any kind of treatment, but I have a methadone clinic down the street from me. I live downtown, and I have a methadone clinic down the street from me. And when it opened, couple of years ago, people in my neighborhood were really worried. Oh, there's going to be all these unhoused homeless people streaming down my street, and it turns out that didn't happen at all. And because it's in an area where it's outside of downtown, um, if you go by there at any given time, you see really nice cars in the parking lot. And that's good to see. It's good to see that there is a place where people can go and feel safe. So let's go back to the consumption sites and where they're allowed to be located. The pressure that happens, and this is happening with you, the pressure that happens when somebody is or something is opening that would be considered sensitive use. And I think you said children, so schools can open, and retroactively, the consumption site has to move because it's no longer 300 meters, but you can't move. You can't, the regulations that came out last January said you can't move actually and stay open. So basically you have to close. That's the only option.
Yeah, so with the change in legislation, there were 10 sites initially affected, and they were within that 200 meters of a school or childcare center. And they were told at that time that they would have to close or transition to a heart hub model. We are lucky in Niagara that we do have a heart hub. We need to remember the suite of services that people need, from harm reduction to treatment and everything in between. So 10 sites were affected by that initial announcement. The challenging situation that we are now under is that there is the potential that a Montessori school is moving in next door to us, and that would be well within the 200 meters. To your point, the ministry has previously made it very clear that sites are not allowed to move. All of the provincial and federal approvals that we get to operate a consumption site are tied to the address itself in the physical space. And again, there has been a lot of narrative around sites not being able to relocate, which is incredibly frustrating. And so we are incredibly concerned about the future of the site with this proposed school moving in next door. And we think a lot about not only what it means for our beloved clients who rely on quite literally a life-saving service, but also for the broader community. A part of the CTS model that we have implemented is around community engagement. So every hour, someone from our team is out engaging with neighbors, engaging with folks who might be congregating outside, reminding people of expectations of behavior, what that looks like, picking up any improperly discarded biohazard supplies. We do work closely through our friends at Queenston Neighbors with the school down the street, and they had identified some concerns from families about, walking to and from school, because the perception is challenging when it comes to safety. And our community engagement workers are out before and after school when kids are walking to and from. So the CTS is part of a broader neighborhood. What we've seen in those areas where sites have closed has been absolutely disastrous in terms of significant increases in public substance use, in biohazard in communities, in overdoses, and unfortunately in deaths. And so, when I think about a school moving in and the closure of the site, not only is that impacting and putting our folks in severe danger, it is pouring back out into the public realm. And so, it might be in the alleyway right in front of the school, or now in our neighbors' yards, or, when we give people a safe place to go where they feel connected to community, where they have access to resources, the entire community wins. And then, we think about, in that 6-year span, the 1,500 overdoses reversed in the space. That is now an increased toll on EMS and the hospital system, which is already overburdened. So we'll see those ripple impacts quite immediately should the site be forced to close, as we have seen in other communities.
Tell you thank you, and I'll let you get back to work because I know this is always a busy time.
Thank you so much, Janice. Much appreciated.
You can listen to all shows of Life Unscripted on your favorite podcast app or on my website at lifeunscripted.ca.